Welcome to the 2025 Open Enrollment Informational Session for Departmental Human Resource and County Personnel Officers. Today we'll be highlighting some very important information regarding this year's annual open enrollment. This presentation is a brief summary and does not constitute a legal document or contract and is subject to change. Important changes. EUTF open enrollment coming in May. The EUTF open enrollment, or OE, for employees will be held May 1st to the 30th, 2025. Open enrollment is the time for employees to review whether their health coverage they have for themselves and their family continues to best meet their needs. More information and the 2025 EUTF Active Reference Guide is available on our website at eutf.hawaii.gov. In anticipation of open enrollment, employees can access the EUTF Member Self-Service Portal at eutfbenefits.hawaii.gov to confirm their current coverage, premiums, and enrolled dependents. Dependent children ages 19 to 25 eligibility update. Effective July 1, 2025, dependent children ages 19 to 25 will be eligible for coverage in EUTF active dental and vision plans through age 25, regardless of student or marital status, and they do not need to live with the employee. Dependent children will lose eligibility and coverage as of the first of the month following their 26th birthday. The EUTF will no longer require annual certification of full-time student status. Dependent children eligibility will be the same under the active and retiree medical, prescription drug, dental, and vision plans. Open enrollment is your opportunity to enroll or re-enroll your child. Closure of the HMSA HMO plan. The HMSA HMO plan will be closed to new subscribers effective July 1, 2025. Employees currently enrolled in the HMSA HMO plan may continue their coverage and can make qualified changes to their enrollment, including dependent changes, by accessing the EUTF Member Self-Service Portal at eutfbenefits.hawaii.gov. An employee that waives their HMSA HMO enrollment may not re-enroll in the HMSA HMO plan. Important dates. Open enrollment election period is May 1st to the 30th, 2025. During the open enrollment election period, employees can add, change, or drop a plan. Keep in mind, HMSA HMO is closed to new enrollment. Add or remove dependents, and change coverage tier, such as changing from self to family or family to two-party. Premium and plan changes effective July 1st, 2025. Employee enrollment change requests and supporting document submission deadline is May 30th, 2025, and employer enrollment submission deadline to the EUTF is June 6, 2025. Here's what you can do during open enrollment. For employees who will not be making changes to their plans, no action needed. Employees are not required to complete any forms to continue current plan enrollment. For employees who wish to make changes, please submit changes and required supporting documents through the EUTF Member Self-Service Portal at eutfbenefits.hawaii.gov by May 30th, 2025. If employees do not submit change requests through the EUTF Member Self-Service Portal, they may submit an EC1 or EC1H enrollment form available at eutf.hawaii.gov and required supporting documents by May 30th, 2025 directly to the EUTF or their Department Human Resource Office, County Personnel Office, Enrollment Designee, or DOE EBU Office for Bargaining Unit 5 and Charter School employees under DOE payroll. Required supporting documents must be submitted through the Member Self-Service Portal, the EUTF, or the employee's Departmental Human Resource Office, County Personnel Office, Enrollment Designee, or DOE EBU Office by May 30th, 2025. The EUTF will not contact employees regarding outstanding supporting documents, and late submissions will not be accepted. Here's some examples of required supporting documents. For self, no documents required. Adding a spouse or partner, marriage or civil union certificate, domestic partnership forms. Adding a dependent child, birth certificate, guardianship decree if legal guardian, or adoption decree if child is adopted or placed for adoption. Employee deadline to submit open enrollment change requests and required supporting documents is May 30th, 2025. Employer deadline to submit EC1 or EC1H forms and required supporting documents to the EUTF is June 6, 2025. Forms must be delivered to EUTF via mail, inter-office delivery, or hand delivered. Forms submitted via fax or Axway will not be accepted. Do not submit forms multiple times. The EUTF member self-service portal website address is eutfbenefits.hawaii.gov. The member self-service portal allows you to view your current EUTF health and life insurance plan enrollment, enroll dependents, and compare your medical and prescription drug coverage to other plan options. Complete an open enrollment event, upload required supporting documents, and download confirmation notice once available in June 2025. And update your preferred method of contact and add or update your personal email and phone number. What's new? Effective July 1, 2025. Effective July 1st, 2025, dependent children ages 19 to 25 will be eligible for coverage in EUTF active dental and vision plans through age 25, regardless of student or marital status, and they do not need to live with the employee. Dependent children will lose eligibility and coverage as of the first of the month following their 26th birthday. The EUTF will no longer require annual certification of full-time student status. Dependent children eligibility will be the same under the active and retiree medical, prescription drug, dental, and vision plans. For HMSA, the HMSA HMO plan will be closed to new subscribers effective July 1, 2025. Enrollment will be limited to those enrolled on June 30th, 2025, and once disenrolled, you will not be allowed to re-enroll in the HMSA HMO plan. Those enrolled as of June 30th, 2025 may still add or remove dependents during open enrollment or if you experience a qualifying event. Remove the developmental delay exclusion for physical, occupational, and speech therapy under the EUTF and HSTA VB active plans. Remove the postpartum limitation of 1 per birth for maternity care under the EUTF active HMSA HMO plan. Added coverage for cardiac rehabilitation at the same benefit level as physical and occupational therapy under the EUTF and HSTA VB active plans, and remove the member cost share up to the eligible charge and the application of the deductible for out-of-network immunizations under the HSTA VB active 9010 plan. For CVS, implemented hyperinflation management where hyperinflated drugs that have readily available, clinically appropriate, and more cost-effective alternatives are excluded under the EUTF active plans. Implemented the basic control formulary where utilization management was added to non-preferred products in 10 specific drug classes under the EUTF active plans. Revised prior authorization criteria for coverage of anti-diabetic GLP-1s. Examples are Ozempic, Mounjaro, Rybelsus, Trulicity, and Victoza under the EUTF active plans. Added 100% coverage of Apretude and Descovy in addition to generic Truvada for HIV pre-exposure prophylactics or PrEP under the EUTF and HSTA VB active plans in accordance with federal law. The brand name Truvada will still require an exception since it has a generic available. For Kaiser Permanente, remove the lifetime limitation of 2 elective pregnancy terminations of non-viable fetuses under the EUTF and HSTA VB active plans. And for HDS, increase coverage of fluoride treatments to 2 per calendar year through age 19 under the HSTA active and supplemental dental plans. Health plan premium and contribution determination. The portion of premiums paid by the employer are negotiated within a collective bargaining process. The employer portion of health plan premiums are not subject to arbitration and are described in the collective bargaining agreements. If settlement on employer contributions to EUTF and HSTA VB plans has not been completed timely, July 1st, 2024 to June 30th, 2025 monthly employer contribution dollar amounts will be used until a collective bargaining agreement is reached. For County of Kauai and Kauai Department of Water, the supplemental collective bargaining agreement effective September 1st, 2024 will end on June 30th, 2025. Until a new collective bargaining agreement is reached, the employer contribution will follow the terms specified in the original agreement. Please note that at the time of recording, both bargaining units 5 and 7 have reached a settlement. Employees are encouraged to contact their employer or check the EUTF website at eutf.hawaii.gov for updated information regarding premiums and contributions. The following are things to consider when selecting a health plan: in-network providers, deductibles, employer cost share, coinsurance and copayments, maximum out-of-pocket, and premiums. Things to consider: in-network providers. Health plan network provider availability. For HMSA, the HMSA PPO plans all share the same network providers. For Kaiser Permanente, both the Kaiser Comprehensive as well as the Kaiser Standard plan also share the same providers. Deductibles, or an annual amount you pay network providers before insurance benefits apply. They're broken into single and family deductibles. For example, under the HMSA 7525 PPO plan, it's $300 deductible per person or $900 per family. Maximum out-of-pocket limit, or MOOP, is the most you will pay out of pocket for covered services per calendar year. For example, under the HMSA 8020 PPO plan, the maximum out-of-pocket limit is $2,500 per person or $5,000 per family. Under the Kaiser Comprehensive, it's $2,000 per person, $6,000 per family. Please keep in mind, each plan has a different maximum out-of-pocket or MOOP amount. Employee cost share is what you pay when services are rendered and can be passed on to you as your co-insurance or your out-of-pocket based on a percentage, or co-payment, or your out-of-pocket based on a flat dollar amount. For example, the HMSA 8020 PPO plan has a 20% co-insurance for inpatient stays and emergency room visits, while under the Kaiser Standard plan, there is a 15% co-insurance for inpatient stays and a $100 co-payment for emergency room visits. Enrollment trends show the HMSA 7525 plan as our most popular plan with 41% of total employee enrollment. The HMSA 7525 plan also has the lowest employee share of monthly premiums among the HMSA plan options, with the Kaiser Standard plan being the lowest costing Kaiser plan. Deadline and reminders. EUTF open enrollment. The election period is May 1st to the 30th, 2025. Employee enrollment change requests and supporting document submission deadline is May 30th, 2025. Employer enrollment submission deadline to the EUTF is June 6, 2025. Online resources. Visit eutf.hawaii.gov to view the 2025-26 Employee Health Benefit Reference Guide and information related to open enrollment, including plan changes and premiums effective July 1st, 2025. Regularly visit EUTF employersonly.hawaii.gov for updates and information for employers. This concludes our session for today. We hope our presentation has been informative and helpful. Mahalo from the EUTF for your time and attention.